Greetings, Creighton Online EMS Instructor Program. Welcome to my office. Did you know that in 2011, nearly 60% of fire-related deaths, on-duty deaths, were due to heart attack and stroke? Did you know that every year, thousands of EMS providers become infected with patients, contamination, and what have you? Today we're going to talk about EMS provider health and welfare. Welcome to EMS Provider Health and Welfare for the EMS Instructor Program Online. This is by Nick Dunbar. The goals for this course will be safety for us as providers, which is number one, and we need to reinforce that and make it so. We're going to want to incorporate this idea into our professional and personal lives and be healthy. Learning objectives and course overview. We're going to have a review of BSI, or body substance isolation. We're going to talk about body mechanics and how to properly lift patients. After that, job health and nutrition, which can be difficult for us on the move and busy running around. And lastly will be strength training for job movements, which is a exercise program I put together which just strengthens the muscles and regular movements we do while on the job. Alright, so BSI for us as EMS providers, our typical get-up is going to be latex gloves, protective eyewear, and a mask. The CDC, FEMA, and local protocols versus what is on the job. Frankly, gloves don't cut it. Some examples: one time I was doing some ride time in Colorado Springs, and I had a call for a lady that was combative and postictal seizure patient. She had bitten the inside of her mouth and was breathing pretty forcefully through clenched teeth, creating aerosolized blood mist. I remember that I had gloves and I had protective eyewear that day, but I didn't have a mask, and I was immediately told to exit the scene and go get a mask from out of the squad. Another thing here in more recent history is the Ebola scare. I know where I work down in Bellevue, we have a specific squad with, well, all the squads actually are outfitted with protective Ebola kits that are gowns, masks, gloves, everything you'd need to isolate your body as much as possible for out in the field. Don't really hear too much about that anymore, but the danger of communicable diseases, regardless of whether they're viral pathogen like Ebola, the danger is out there, and sometimes we don't realize that. So I think we need to keep them on us and keep them readily available, because you don't really know what you're going to be walking into. Always have that index of suspicion that this could be increased danger for exposure or contamination. Just to reiterate a little bit with the idea of what we should have readily available on us as a minimum, I feel gloves, which everybody usually does on a regular basis. However, mask and protective eyewear are not always carried, and it's important that we continue to do so. A little more on body substance isolation when it comes to our patients and the risk they pose to us. Kelly Vogel may say that the patient has more to worry about from him than he does of them, but I've been around some pretty scary people sometimes, and you don't know what this guy's carrying. I mean, obviously he's in a little bit of lawful custody there. However, we frequently pick these individuals up, and you really have no idea where they may have been or what they have done. So here we have a guy wearing a spit hood, which can protect you and everybody on scene from whatever might be coming out of this guy's mouth, aside from foul language. And also patients that are coughing, maybe place a mask on them. Moving on from BSI, another very important aspect of our job is body mechanics and lifting patients properly. The best way to do this to avoid injury is to be cognitive of your stance and posture. You want to use your legs, not your back. Keep the weight as close to you as possible. Obviously, you want to know your limitations and try not to lift patients that are morbidly obese in the ranges of 300 and up, I would highly suggest requesting help. And before you lift, you want to communicate clearly and effectively with your partner on how you plan to do so.
So here we have the most common of all patient lifts. The patient is secured and strapped in the backboard. This one happens to be using her cell phone, which is also not uncommon. Key points to remember on this one is lift with the legs, keep your back straight and locked. Keep eye contact with your partner and give off count of 3. You ready?
Oh, you
All right. Here we go. 1, 2. And that's how you properly lift the patient.
I'm going to change gears a little bit and talk about nutrition and health on the job. A lot of times it's what we do in our personal lives that determined our risk for injury and susceptibility for harm. I'm going to use the Ketch-McArdle formula to figure out our daily caloric intake, follow some of Michael Matthews' diet suggestions, and how to create pre-plan for meals. So here we have the Ketch-McArdle formula for caloric intake. This will determine our daily number of calories we need to consume each day. First we have to find our percentage of body fat and plug that into the lower equation for our lean body mass, and then that will determine our basal metabolic rate in the equation up top. You can do this by purchasing a scale that can determine body fat relatively cheaply online, and the website or link down there at the bottom will do the math for you. Lately I've been following Michael Matthews' diet suggestions. Kind of the standby as far as protein intake has been you want to consume 1 gram of protein per pound of body mass daily. 1 gram is 110 calories. The best forms of protein we can consume are eggs, then casein, then whey isolate. And in that order. Eggs are the perfect protein. They have every essential amino acid you need and have the longest time spent in the body, so they're available for a longer time. So 110 calories per gram. You want to subtract that from the Ketch-McArdle formula for your daily caloric intake, and then that will determine you want to fill in the rest of those calories just with a well-rounded diet. To avoid dehydration, drink 1 gallon a day for men and 3/4 gallon for women. Like I said just previously here, you want to fill in the rest of the nutrient-rich diet to fill out the rest of your caloric needs. Some examples: greens, beans, berries, whole grains, seeds, potatoes, mushroom meats, and fish. Following through to make sure you eat healthy, the way to accomplish this successfully is to create pre-plans for your meals, as you can see in the photograph there on the right. A lot of times you can spend one day and with a bunch of Tupperware have all your meals for that week, or 3-4 days at a time, just set ready to go. Take them with you. As a minimum, if I don't have this available for me, I always make sure that I bring water, a granola bar, Cliff Bar, and some protein, etc. Now on to strength training for job movements. The following is video put together earlier at the gym, which is exercises that will make your life much easier as far as lifting, moving patients properly, and avoiding injury yourself. Here we go. Alright, so here we are at the gym, and we're going to focus on some lifting that will make the rest of your patient care on the job much easier if we strengthen these muscles. What I usually like to do is warm up on the stair machine to get the heart rate going. I'm going to show you a quick example of all these exercises and proper demonstration of which. So, alright. Alright, so next we're going to move on to the deadlift, and this is perhaps the most crucial for all the lifts, power lifts, for what would be like lifting up the cot and getting patients ready for transport. It's going to work your back, your legs, and the important thing here you want to realize is that you're not lifting with your back. You want to keep your back locked and straight as you bend down. Bend your legs, and then like with an interlocking grip, gives you a better better grip on the bar, and we're just going to shoot up from the balls of our feet and get to the top of our lift. So here I'll show you a demonstration. This next exercise is called the Romanian deadlift, and much like the deadlift itself, you're going to be working and focusing more at the height of the peak of the exercise, or the load in that motion, and it's just going to further strengthen kind of a critical point in movement where a lot of people experience injury. And so this part will emphasize all the little micro muscles in there to strengthen them, the accessory muscles, strengthen them to avoid injuries. Okay, so next we're going to move on to the cable row. Just another exercise that's going to strengthen our back muscles, be able to keep a strong, straight, solid back as we're lifting our patients. Also, we're going to have a rowing motion that's going to work your arms and your biceps. Okay, so the last two exercises I wanted to talk about are going to mainly help when you're moving patients from bed to bed, or like the draw sheet method with you and your partner. You'll be going from the patient's bed, wherever you found them, to your cot, and then cot to gurney, whatever. It's going to be wrist curls, and then we're going to move straight into a regular dumbbell bicep curl. So I'm going to start with kind of a moderate weight here. Basically hold my wrists down like this, and just moving those forearm muscles. I usually go for a rep of about 60, and then I switch and alternate, going to the top and do upward curls like so, for another 60s. With some dumbbells here, and just same thing, just regular curls. Going up, hold for about a second, back down. Sets of 10. To recap on this strength training exercise for job movements, we started with the stair climber, did that for about 5 to 15 minutes at a warm-up pace, moved on to deadlifts for 3 to 4 sets of 6 reps, Romanian deadlifts, 3 sets of 10 reps, cable rows, 3 sets of 10 reps. The wrist curls, we did 2 sets of 60 with both under and overhanded, and then finished up with bicep curls, 3 sets of 10 reps. This has been a brief taste in EMS provider health and welfare. In summary today, we covered the importance of body substance isolation, use it, body mechanics and proper lifting techniques. We talked a little bit about on-the-job health and nutrition, and finished up with an exercise in strength training for job movements. If you have any questions, comments, or concerns, please feel free to email me or leave board comments in the class. Thanks.